Overdose Awareness Day is coming up on August 31st. It's a chance to raise awareness for an issue that is impacting people and families all across Colorado and the country. Today we have Dr. Eric French with Mind Spa today, and we wanted to kind of focus on the intersection between substance use and mental health. Can you explain that to folks?
Yeah, I think the interface is really important because oftentimes untreated depression and anxiety or trauma history are huge driving factors that lead people to start self-medicating in the first place. So it's very important.
Is there any specific condition that you see tends to trigger or lead down that path, maybe more than others, or is it kind of across the
I think anxiety and trauma are probably the two biggest ones. You know, really, anytime somebody is struggling with depression, anxiety, or trauma history, if it's not being dealt with in the right ways, these things don't tend to just fall away on their own. And so unless people are managing themselves, taking care of themselves in the right way, it starts to compile. And when they realize they're not feeling well enough and it's not going away, then they start reaching for other things to self-medicate.
You know, we were just talking about how sometimes it's a little bit hard to see in the future of some of the stuff kind of building and, you know, coming your way. What are some of the signs that a person can watch for?
Yeah, I think if somebody is developing any kind of self-awareness around their relationship with any substance, whether that's alcohol or drugs, is the pattern of use more escalative? Like, are you reaching for this more often? Are the doses that used to help you relax and calm down, are those not the same doses that help anymore? When we find that this pattern is starting to escalate, these are substances of abuse because we build tolerance to them, right? And then that's really where we get into these exaggerated use patterns where, you know, not even one beer is enough, a six-pack is not enough, and it's hard alcohol and all of these other things. So it really catches up on people quickly.
Yeah. What about for family and friends who maybe are starting to notice those signs, maybe before even the person is?
Right.
How do you step in an effective way versus a conversation that just shuts the conversation down?
Yeah, exactly. One of the things I tell my patients, because I get this question a lot, is like, you really first have to make sure that you have the right kind of rapport with this person. We care about each other, but we have to make sure that we have the kind of rapport where we can approach the topic. And I like to get consent first. You know, I think asking the person, can I provide a reflection? Like, can we talk about something? And make sure that they're even in a place to listen. Because, you know, just coming out of left field with it is most assuredly going to cause some defensiveness and rigidity around being able to receive this reflection. So, but just letting them know, like, hey, I see that you are drinking a lot more, or you're using this a lot more. Are you okay? You know, we don't want to rush to label them for that, but to just use that as the opportunity to check in. Are you all right? Like, is there something that you want to talk about? I am here to listen.
Right. Yeah, it's an easy way to like ease into that conversation and kind of test the waters.
Exactly.
You know, we're expecting to have a lot of stories, a lot of conversations over the next week, but this kind of information is something that you can access year round, you know, through people like you as well. So we really appreciate you coming on ahead of Overdose Awareness Day.
Always happy to be here.
Thank you so much.
Absolutely. Thank you.